बोलो। यह है लिवर। लिवर का दो सरफेस मेनली होते हैं, डायफ्रैग्मेटिक सरफेस और नीचे होता है विसरल सरफेस। डायफ्रैग्मेटिक सरफेस मीन्स सुपीरियर, एंटीरियर, posterior and right surface. Okay, four surfaces together build up the diaphragmatic surface, and there is the visceral surface. What separates the diaphragmatic and the visceral surface? It is divided by the boundary of inferior body. Okay, now this is so we should learn about the ligaments of the liver, which are very important. Anatomical lobes and physiological lobes too. Anatomical lobes here is divided by the falciform ligament. This one is the falciform ligament which divides the anatomical lobes. This one right lobe, this one left lobe, from superior and anterior portion. Okay, superior and anterior, the anterior lobes are divided by the falciform ligament. Okay, and then there is inferior. Inferiorly, it is divided by the this one is the fissure for ligamentum hepatis teres, and here it is the ligament fissure for ligamentum venosum. Ligamentum hepatis teres is the remnant of obliterated left umbilical vein, while ligamentum venosum is the remnant for obliterated ductus venosus. So this line divides the anatomical lobes into right and left, inferiorly and posteriorly. In physiological lobes, it is divided by the groove for IVC and the fossa for gallbladder. This one is called the Cantil's line. So Cantil's line divides the liver into physiological lobes, right and left, while this fissure divides the liver into anatomical lobes, right and left. Okay, now as we can see, the inferior border shows us two notches. Here is the interlobar notch between the two lobes, where it is where ligamentum hepatis teres is present, while here this one is the cystic notch, where the fundus of the gallbladder is present. There are few areas where the peritoneum is absent in the liver. This one, Bayer area, the Bayer area. Remember the Bayer area. Then it is the fossa for gallbladder. Then the groove for IVC, the porta hepatis, and the groove for ligamentum venosum. These are all the areas where the peritoneum is absent on the liver. Moreover, we can see other ligaments too, which are false, because they are like compression of the peritoneum only. Here the Bayer area is bounded by, here it is the superior coronary ligament, here it is the inferior coronary ligament. Superior, inferior, and here the apex is guarded by the right triangular ligament, and here it is the left triangular ligament. This one is the caudate lobe, which is guarded by the groove for IVC and the groove for fissure for ligamentum venosum. This one is the quadrate lobe, which is bounded by the porta hepatis above. This one the fossa for gallbladder, and this one the fissure for ligamentum hepatis teres.